My name is Jess Ganem, and I'm a professor of psychiatry and global health sciences at UCSF. And I'm the moderator today for this really amazing and important fireside chat that we're having that's being hosted by the Bay Area Global Health Alliance. The Bay Area Global Health Alliance is a global health community with 70 member organizations, academic institutions, NGOs, and nonprofits in tech, biotech, and other private sector companies, all committed to working together, building connections across sectors, sharing knowledge to advance global health equity and innovation. And we're just absolutely delighted to be sponsoring and hosting this event for you. This is a very important topic. Obviously, the title of our fireside chat today is Despair and Hope, the Global Mental Health Crisis. Just this week, there's been tremendous kind of notoriety of this very topic. Recent CNN and Kaiser Foundation poll found that 90% of Americans, when 90% of Americans don't agree on anything these days, but 90% of Americans believe that we are in the midst of a mental health crisis right now. Of the population that was studied, 50% actually said that they had a crisis within this period of time that we consider generally the pandemic, and were unable to access mental health treatment. So the fact that we have a crisis is not breaking news. What are we going to do about it is rather topical and important, and that's why we're having this fireside chat today. I could tell you just from my own experience, kind of as a professor at UCSF and also a clinician, that the real world consequences are quite significant. I could just tell from my emails and my calls and my texts, every day I get calls from tech leaders, from employees, from employers, from patients, from colleagues, desperate for help, basically, and requests for referrals. And the real world reality, if I can use that word, is that access and demand are not connected right now. There is a tremendous demand. The supply of qualified clinicians being able to provide those services is not large enough. We have a resource problem, we have an access problem, and together with that, we're just coming out of the pandemic. So this is a real topical event, and we're going to welcome you all to engage with us and have some discussion about this. We have two amazing speakers today. I can't do justice to introducing them, so I'm going to apologize to them ahead of time for just doing a brief bio, because they're truly extraordinary. I would call them clinician scientists, because these are individuals who are both clinicians. They treat individuals who have mental health diagnoses and struggles and things like that, but they also are researchers. So we're delighted to have Dr. Amy Green, and Dr. Green is a clinical psychologist with decades of experience leading research on youth mental health. She's Hopelab's head of research, and Dr. Green brings scientific and methodological expertise to Hopelab's collaborative work, focusing on leveraging technology to promote thriving and health equity for young people, particularly those in the LGBTQ community. I'm very excited that she's joining us today. And then we have Dr. Renee Schneider, who's also a licensed clinical psychologist and the lead in the Mental and Behavioral Health Center of Excellence at Google. And Dr. Schneider comes with a decade's worth of experience in this area. We're very excited. She's done research focused on parental socialization of emotion in school-aged children, as well as examining the relations among child abuse, intimate partner violence, and substance use. Again, I'm sorry to the two of you for not doing justice to your expertise and your background, but with that being said, let me begin by introducing Dr. Amy Green to see if she can lead the first 5 to 7 minute part of the discussion, and then we'll turn it over to Dr. Schneider. Dr. Green.
Sure. Thank you so much, Justin. So great to be here with you and Renee today to talk about this. I'll start by just giving a little bit more background about why I'm here, how I got into this, and where we go, and then we can take the discussion from there. So as just mentioned, Amy Green, I use she, her pronouns, currently the head of research at Hopelab, which is a social innovation lab, impact investor focused on the intersection of technology and youth mental health and wellness. Got into this work because I got into this work when I was a young adult, or as some may know, the definition of adolescence is now expanding up towards age 25. And so in some worlds, I was an adolescent when I started doing work fresh out of college, working in adolescent medicine and community prevention out of my own experiences and the world that in that time in the 90s growing up, the struggles were there in terms of my own struggles with mental health, my peers' struggles with mental health, in a situation where then we knew that there wasn't the support that we needed, even though it wasn't talked about as much. And then went to graduate school for clinical psychology thinking, we're going to fix this. This is an area of need only to be met by folks who have been doing this work for decades. And one of the turning points of my career was being at a group of folks who were really pioneers in the youth mental health field and mental health services, and who were nearing their retirement stage. As a group of us were nearing our professional careers, sort of this changing of the guards, and they sat around and thought, oh, like we've spent our whole career doing this. Did we make a difference? And by all standard metrics that they could come up with, as researchers do, they came to the conclusion that they didn't. The mental health of young people in this country, and this is probably like in the early 2000s now, had not improved over the 70s, 80s, 90s, the years that they were doing this. And so their call to those of us who were the younger scholars in the room was, our hope is that we have trained and inspired you all to take this on. And so that has been the call of my career since then, which is I want to retire in a couple more decades, looking back and not passing it off to someone else and saying like, well, we tried really hard. It's the thing that we're dedicating our career to, but we really didn't see any change. And so, I started in academia, really focusing on dissemination and implementation science, because I think we have a lot of really great solutions. As Jess alluded to, it's an access issue for the most part. We have therapies that are evidence-based. Can we use more that are for different populations that are more specified? Absolutely. But our biggest problem is access. And so I went into dissemination implementation science as faculty at UC San Diego, did work there, and then actually moved into the community. I was at the Trevor Project doing research on LGBTQ youth mental health for the past 4 years. Trevor Project being the world's largest suicide prevention and crisis intervention organization. And that's when COVID-19 hit while I was there. And I remember thinking about what a game changer it was, both in the ways that we all think about it, in terms of how horrible it was and how it's really spurred this mental health crisis. But as someone who's been in this game, who put my career here, I thought, oh, this is a shift. This is a shift when people have to do something differently. They have to pay attention to mental health right now. There's that 90% number, bipartisan agreement that we have to address youth mental health around the world. There's hard to get that much agreement, anything. And while it's really unfortunate that it took a global pandemic for that notion to come across in politics, in funding, in business, that this is an area we have to address, it has. And then the other part is technology, and the idea that once folks weren't able to see people in person, all of a sudden, a lot of the requirements around telehealth and reimbursement and billing just disappeared. Things that people would have worked years and years and have worked years and years to try to deal with those. And so, I come at this now from a hopeful perspective, which is a weird place to come out of the pandemic we're still in, with hope for youth mental health. But I really do think that something had to happen, some big shift had to happen, because we've been going down this path of it being a problem that we're not solving for a long time. And I think right now, among young people in particular, stigma is reduced. It's hard to have so much stigma for something when a good percentage of your population is experiencing it. There is business interest in it. The number of mental health tech startups in the past couple of years have really gone up. There are policy changes being made for it, and technology is really seen as something that can overcome it. So I think the title of this talk was Despair and Hope. And I think it's a great title because I think there's so much despair, but I also see so much hope in terms of where we're at, that hopefully we get to that place where I can retire saying, oh, thank goodness something finally happened. I can see the change, and I don't just have to hope that the next generations do it.
Wow, thank you, Amy. That was really great. To hear you talk about retirement, don't hold your breath on that. We're going to need you. This is
a couple of decades at least. I no
okay.
time soon.
Okay, great. Well, thank you so much. What I'm going to do is I'm going to give it to Renee right now. We're going to let Renee make some introductory comments. Once Renee is done, then we'll start with some questions and discussion. Renee.
Sure. Sorry, my light where I'm at in the Google office periodically goes out, so thanks for bearing with me. Thank you for inviting me to be a part of this panel today. I'm really looking forward to the conversation. Such an important topic. I come from primarily the mental health startup world. I was the VP of clinical quality at Lyra Health, where they're using technology to try to match children, adolescents, and adults to the right type of mental health care at the right time. And was the VP of therapy at Brightline, which aims to do very similar work, but with children, adolescents, and parents. You know, I look at the problem and the despair and hope that Amy mentioned. I mean, it is right there. I feel hopeful, and that's why I joined Google. I feel that there's a promise that technology offers us to make an impact. But when I look at the statistics, I can't help but feel some despair. You know, we know that globally about 1 in 7 children and adolescents have a mental health disorder. Suicide is the second leading cause of death in the US among children 10 to 19, the fourth leading cause globally among older adolescents and young adults. And I do think that there is this, as Amy said, there's definitely an access problem. We have evidence-based treatments that have been tested in randomized controlled trials, and we know they work, but children and adolescents aren't getting those treatments. So in the US alone, maybe 50% of kids with a mental health disorder get treatment, and most of them are not getting the treatments that we know work. And they're not getting culturally responsive care. Even when they do get care, there's a long lag time. So somewhere between 8 and 11 years between the start of symptoms and when that child or adolescent actually is able to access care. So a lot of problems to overcome, but I really do believe that with technology, there is this promise of being able to have a major impact. That's why I joined Google. I feel like Google Health's mission to better the health of billions of people really resonates with me as a clinical psychologist. And we're doing things in this area that we couldn't do alone. You know, Google as a technology company is able to do things like we have a machine learning model that identifies users in crisis. So if somebody is typing in a query into search that indicates they are suicidal or in crisis, we can identify them, and then we can surface information for them that's authoritative, and we can show them stories of hope and recovery, and of course show them the number to the national, in the US, the national lifeline number, the 988 number, globally, other hotline numbers. So there's a lot that we can do, and I'm really looking forward to talking with everyone today. So thank you.
Renee, thank you so much. You know, the title Despair and Hope is something that, you know, I thought really resonated. I was slightly more on the despair side of things before the two of you started. Now, after hearing from Dr. Green and Dr. Schneider, I think I'm a little bit more on the hopeful side because it's really difficult out there. I'm going to start off some of the discussion, you guys, and I'd like to start with Amy, if that's okay. Obviously, we're in a crisis. and some of the more vulnerable populations out there, we have a subset, obviously, children, adolescents, young adults. Even within that vulnerable population, we have struggles with LGBTQ plus individuals. And I wonder, what are the specific tech-enabled solutions that might be out there that can be, you know, targeted, if you will, towards these more vulnerable communities, especially among LGBTQ plus youth?
Yeah, thanks, Jess. And that's so the pandemic has been rough for everyone, but there are populations of youth, as you mentioned, who were already more marginalized, more vulnerable before the pandemic, and it just kind of exacerbates them, things for them. LGBTQ young people being one of the populations that I've done the most research and clinical work with. You know, it's challenging because some of the factors that influence the well-being of LGBTQ young people are not internal, meaning that they're caused by a lot of external forces, the rejection from their family, the policies that are coming down at a national level, restricting their rights, discrimination, victimization. And so when we think of treatments, yes, there are certainly ways that the types of treatments that we've had, cognitive behavioral therapy, there's even LGBTQ affirming cognitive behavioral therapy are great, but there's also other needs when we think of LGBTQ young people. And a lot of times that comes down to identity formation, acceptance, and affirmation, things that are super important in adolescence in general. That's part of adolescence, is that identity development period. And for LGBTQ young people, a lot of them don't have a place where it's safe to be in that space. So the majority of LGBTQ young people do not live in homes where their identity is affirmed and accepted. For a lot of them, their peers, and for a lot of them, their schools. Most of the time, peers and schools are more accepting than your family and your home for LGBTQ young people. And then we think about what the pandemic did in terms of that isolation. And for a majority of the country, LGBT young people are already isolated if they're not in a home. So it's not just the pandemic. These are longstanding issues in terms of how they connect with others. And so a lot of the tech-enabled solutions, and a reason why I think when people talk about that, technology and social media are ruining the lives of young people and they're glued to their phone and they're glued to their phones, there are absolutely harms that come with social media and with tech-enabled devices. But on the flip side, for populations like LGBTQ young people, that's their community, that's their acceptance, that's their affirmation. And so there are the LGBTQ Center. Centerlink has something called Q Space. The Trevor Project has something called Trevor Space. Their social networking, development of profiles, development of identities that allows young people for Trevor Space across the globe. So anywhere in the world, not just US based, who wants connections, wants affirmations, wants to explore their identity, talk about common issues, to have a whole group of peers in that space where they know they'll be accepted and they're affirmed. And it's moderated in such ways that there's some of those safety protocols there as well. And of course, because it's operated by a mental health and suicide prevention organization, it has that built into it too. Same thing with Centerlink in terms of their moderation. So I think that's one of the areas in terms of these platforms that allow LGBT young people to connect. It's not what we typically think of for mental health. It's not someone meeting one-on-one with a therapist. But it's been said a number of times. I heard it the first time from the CDC's Division of Adolescent School Health. They're like, we're not going to mental health professional our way out of this. There just isn't, there's not going to be enough clinicians out there to have one-on-one individual sessions with every young person who needs it. And so when I think of tech-enabled solutions, there's absolutely, we need way more of that one-on-one therapy. There's no replacement for it, but also we need more solutions that can reach people, and those types of connecting platforms are great. Hopelab, where I currently work, created something called IME. It was co-created with LGBT young people, particularly those who were youth of color, trans and non-binary, to allow them access to explore their identity, to develop coping skills, to hear positive, uplifting stories from other queer young people across the country. And again, that was done in a randomized controlled trial to show to increase their perceived coping skills after using this intervention. One of the interesting things that when we talk about tech-enabled solutions and why it's so important to have young people involved in their creations. So some people might be like, oh, maybe it should be an app. So IME is a website. Trevor Space is access through a website. They're not access through apps. Why would we maybe not want a nice queer app on a young person's phone? Well, their parents may see the download. Their parents may see the app. The features of both of those websites have things like quick exit buttons, ways to show youth how to clean their browser history, not because there's anything wrong happening on those sites, but because of the challenges that could be perceived by being accidentally outed to a parent and what harm that could cause. And so when we think about these types of solutions, how important it is to have young people involved in those decisions and to have members of the community involved. Otherwise, we run the risk of creating something that's potentially harmful. But I think that those are both really great examples. IME, which is available at imi.guide, freely available to any queer young person anywhere in the world, just ways that we, at that first level of before you get to a therapist, how can we broadly address the mental health of a broad group of young people?
Wow, that's really great, Amy. I have about 20 different questions just based on what you said. But before I get into some of my questions, I think from the audience, there's some questions about, you said that this was a worldwide app or application that was being able to access, LGBTQ folks from around the world would be able to access. Well, how do we build in cultural respect, cultural dignity, and cultural sensitivity to LGBT youth in, let's say, locations where maybe the culture's relationship to some of those issues is very different than what we have here in the United States. How do you negotiate and navigate that?
So I should say they're available. They're not necessarily. So Trevor Space, for example, the moderation at this point, I believe it will be expanding at some point, is English only. So English speaking in terms of the moderation, because it's flexible, the young people are really the drivers. So the goal of it is for young people to connect with each other and to learn from each other and to share about their experiences. And so in that way, and can create special subgroups, they're called clubs, I believe, but can create clubs so that if you're a young person who lives in Japan and you are able to speak English and you want to join on Trevor Space, you could meet up with other folks in your area and discuss those issues. You could also learn from what's happening in other countries. In terms of IME is freely available to anyone, but you're right in that it was created here in the US. And so while a lot of the stories and narratives, because it focuses on things that we think are typically pretty universal, coping skills and identity, they may not apply in other places. And I think that the key of both of these resources is that they're not telling anyone what to do. They're not prescribing anything. And I think that's where we get into a little bit more challenges, particularly regarding safety and what works. They're allowing people to reflect, to journal, to think about themselves, to think about who they are, who they want to be, concepts that tend to be fairly universal for folks that want to explore them. But I do think that gets more challenging in terms of how do we design something, and I don't know what the answer is. How do we design something, an intervention that has global appeal and that is appropriate for different cultural contexts? I think that gets more challenged when you get into the intervention. It's a little easier when you're at this more universal level of interact with people, learn about what coping skills are, ask questions about your self-identity where there is no actions taken as a result of it. But certainly an area where for LGBTQ young people in particular, there's so little out there. And that's what ends up, that's one of the reasons why these products end up getting used globally, is because there's a big gap everywhere. And so people are willing to grab onto. And so I think one of the next steps is how do we keep evolving and designing so that LGBTQ young people around the globe have access resources that are appropriate and respond to their needs. And one of the answers is having those people involved in the development. So I can say enough of that, right? Like one of the answers is to have those people involved in that process.
Well, I was just going to say that part of the work that I've done globally has been focused on Middle East, North Africa, Southeast Asia, and Central and South America. And, when I do consulting on, startups and mental health apps and things like that, I'm always struck by the lack of diversity in terms of representation, in terms of people, creating these apps with the communities that are in dire need. To that, we'll kind of come back to that a little bit. I just want to put that out there. I appreciate your answer a lot, but I do think in terms of global, issues, we have a lot of work to do when it comes to cultural dignity and cultural respect in terms of some of the apps that we develop here. But that's a long discussion, which maybe we'll have time to come back to. Thanks, Amy. Hey, Renee, given all that, if we acknowledge some of the limitations around cost and access that are obvious in terms of the mental health crisis, what ways can technology improve the mental health of people from these underserved communities? Where do you see the leverage of technology coming in to help us?
Yeah, well, I would echo some of what Amy has said. I think that there is something very powerful about being able to connect with someone or being able to hear the story of someone who looks like you and sounds like you and has had an experience similar to you. So YouTube, for example, has a project right now where they're teaching creators how to tell their stories. And this will allow people who, might not otherwise, somebody who's trans and might not otherwise know anybody else who's trans and experiencing, that sort of, whatever is going on with them, they're able to connect with that person or hear that story. So I think that's one way. The other thing that Amy was talking about was evidence-based interventions and there not being enough therapists. I think technology can be used to train, in a lot of countries, paraprofessionals. In the US too, we know that from the empirical research that CBT, for example, behavioral activation, parent-child interaction therapy, all of these interventions for kids and teens, that they can be taught to people who are not licensed and they can deliver them effectively. And so if we can use technology as a way to disseminate those interventions, I think that could really improve the access problem. I would also say, there's something here with technology about health literacy. We know from studies in the US and the UK that it tends to be more educated women who have the highest rates of health literacy. And health literacy is associated with greater access to care. So people are more likely to seek care if they have higher rates of health literacy. So parents who know more about mental health problems and have less stigma are more likely to seek care for their kids. And I think that we can use technology to share authoritative, valid resources with parents, with teens, so that they can learn and reduce stigma and hopefully improve their health literacy. So those are a few of the ways.
That's great. How do you think about, and again, I'm thinking more on the global scene, just in terms of, let's say, parts of the world where access to technology, smart devices, bandwidth issues, things like that. How should we approach that, in addition to some of the cultural issues, obviously, but just some of the bandwidth, accessibility issues of tech in, frankly, most of the world right now. How do we approach even thinking about that problem in terms of some of the things you've brought up?
Yeah, it's a great question. I'm encouraged that a lot of people these days have a smartphone. They may not be able to afford a Fitbit. They may not be able to afford a watch, a smartwatch, but a lot of people do have access to search. And so that is one way that we can support people from different communities around the world. I do think that the bandwidth problems and the, being able to afford a computer, for some people that's insurmountable. Those are insurmountable obstacles right now. And so having like a centralized place, for example, where we can train paraprofessionals, and then like a train the trainer model, and they can go out into communities, is one way to disseminate that information. So I think a lot about sort of, are there centralized locations where people gather, where we could share that technology or share information via technology, and then communities can take that and disperse that information how they see fit.
Great. I want to just share a little bit about a project that I started and is now kind of up and running in the Middle East, for example, where we were working with children in communities that were exposed to war, violence, and did not have access to the traditional models of, one-on-one therapy, and for lots of reasons, access, resources, cultural issues. So what we did is that we set up this concept of a therapeutic playground, and to deal with the problem of scale. So instead of dealing and working with children, let's say one-on-one, or parents one-on-one, what we did is created a relatively large playground where children and parents could come, engage with one another in a therapeutic setting, have different stations and things like that. And so while the children were engaged in play with paraprofessionals, then the parents would get psychoeducational kind of information and lectures, again, in a group setting. I've always found that groups and group engagement and group processes can be very, very powerful. And I just wonder how, and this is for both of you, by the way, how do we leverage the power of group support and group engagement with these crises that we're having and technology? So do you mind if I start with you, Renee, and then we can go to Amy? What do you guys think about that?
We're at Google, we're trying to show people who are in crisis stories of hope and recovery so they feel a sense of connection. I think there is something about the pandemic that has made us realize how important our community is. When you don't have it, you realize that it's important. And loneliness has come to the fore. We know that people are feeling especially lonely, and that's associated with depression, that's associated with substance use, eating disorders. And so to the extent that we can connect people, I think that is going to be helpful for their mental health, particularly adolescents. We have to be thoughtful about how we do it, though, because obviously, like Amy mentioned, some of the platforms being moderated, we don't want, for example, adolescents who have an eating disorder sharing information that could be harmful. But I do think that having online groups, having places where parents can connect with one another, can also be really powerful.
What do you think, Amy?
So I'm admittedly a group therapy lover in terms of I think that they are fantastic for efficiencies, for scale, for the benefits that other people have from also helping other people. I think people forget that part of group therapy is also seeing the externalizing of seeing someone else and knowing, hey, I know what we could apply to this. I know it helps someone else, and the power that has. The group therapy problem, and I've said this before, if I explain to people, is that almost everyone could benefit who needs mental health care could benefit from group therapy. Almost everyone thinks that they are the exception, and that they need individual therapy. And so group therapy, which I love, needs a little branding help in terms of and demystifying of what it is, because a lot of people feel like what they really need is that one-on-one relationship with a provider, and that if they're in a group, they will be uncomfortable, they won't fit in, they will be more severe than everyone else, they will be less severe than everyone else. And so there's a lot of anxiety that folks have about groups. And so I think one of the first steps to getting there is to demystify the process a little bit, to show people more stories of what it can look like, the benefits, how it's helpful. Also from their end, the cost reduction of groups compared to individual therapy as well. So thinking about what the benefits are, there are actually some really cool apps that I know of that are working on that power, particularly for issues like social anxiety and anxiety with young people. The idea of connecting to peers. I think for young people, if you listen to young people right now, across all the places and settings that I've been where young people are talking about what they need, they actually want their peers to be those who are able to help them and who they can turn to. And so leveraging that peer support as part of groups with a trained facilitator, it's actually what young people that I've heard talking about wanting. But when you say group therapy, I think it has a different meaning to it. And so from my end, yes, I think that there are huge ways to, one, leverage technology with it, to have more scale, and 3, have people really benefit from it. I think we just have to figure out how we get people to really be into the idea of it, because once people do group therapy, and for those of you who are clinicians who have been there, people end up liking group therapy. I've had lots of people who say like, oh, I actually really benefit from it, but most people think they won't. And so that to me is part of the change.
No, I really want to echo that, but I'm sorry, Renee, you were going to say something?
I was just going to ask Amy, do you think that, because I agree with you completely. I mean, study after study, all of the work that we do anecdotally, we know that young people, that adolescents want to hear from other adolescents. And we know that these group therapies like behavioral activation for depression, very effective in a group setting. Do you think if it's like a linguistic issue, like if we call it support groups, that it would be more welcome? Because I've had the same problem where clients just, no, group's not for me.
Yeah, there's something, I don't know if support groups, I think this is probably one of the places where a nice group of having young people in, like that youth perspective and figuring out like, here's the problem, here's the thing that you all are asking for, here's what we already have, like, what are we doing wrong? What parts of this make this seem intimidating and this be what you're looking for? I think it's probably a combination of the linguistics, how we call it. And I think probably the perception of how much power a group leader might have, or how it's structured, confidentiality issues. I think just a bit of, for young people with therapy in general, I find that there's a lot of fear and resistance to anything that they don't understand. That it's sort of this mystery box. And that one, so an example is one time at the Trevor Project, there's this group called the Try Guys. They do YouTube videos. So they did a crisis intervention call, demystifying what it's like to call a crisis helpline, and just through the roof with young people reaching out, because they don't know, like, is a crisis line for me? Will they take me seriously? What happens? And I think with mental health in general, we need to show a little bit more about, like, this is what it looks like. This is what it, even if it's a dramatization, which that was, like, this is what therapy would look like with you and peers. This is what it would be. And be like, oh, that seems super helpful. Like, that's not scary. So I think there's that part of just reducing the fear, making them feel comfortable with it.
Yeah. I think parents want groups to, I think parents like groups. I'm thinking about like Family Connections, which works with, they have a train the trainer model, and they work with parents of like adolescents or young adults with BPD, with borderline personality. And parents really like that program. They like connecting with other parents.
Yeah, I think people like connecting with one another, especially in the light of, the last number of years of the pandemic, the isolation, and now people kind of coming out of it. And so that's why I'm also a big proponent and big fan of whatever we call it, group therapy, group engagement, group process, community engagement. I mean, there's so many different words for it, but I think we're all kind of in agreement. I guess this is one of the few times you can get 3 shrinks to all agree on one thing, right? That the group process and getting people together in groups can have a big benefit. The issue of scale, the issue of connecting amongst one another, it all kind of makes sense. I'm keeping an eye on time, you guys, and it's the top of the hour. It's 11. We have maybe 15 minutes plus. I want to make sure that if there's other questions from the audience, that they can send questions to chat, and our people moderating in the background will get those questions to myself and our speakers, and we'll kind of go from there, because I've got a ton of questions for the speakers. So I'm going to kind of jump in really quick, but I want to encourage our audience to kind of jump in too. So we've been focusing a lot on youth and young adults, adolescents, children, things like that. I want to talk about adults. I want to talk about quiet quitting. I want to talk about the workplace and just the number of calls that I get for referrals from, CEOs of tech companies, regular companies, human resource people. I mean, there is also a crisis in the workplace with people coming back to work, engaging with one another again, and lots of anxiety, lots of difficulties, clearly. And I wonder what thoughts you guys have about how can we frame this discussion with the crisis that we're seeing in the workplace right now, and just kind of free flowing on that for a bit. Renee, do you want to jump in?
Yeah, I'm happy to talk about that, since I was the VP of Clinical Quality with Lyra Health for 5 years, nearly 5 years, and we sold to employers. So I heard from quite a few employers about the difficulties, both before the pandemic and during the pandemic, the difficulties that their employees were having. It was obviously worse during the pandemic, but there was still a lot. I mean, mental health problems haven't sort of suddenly emerged. I think you all know they've been around, they just haven't been receiving attention. And I think the pandemic has shined a light on them. We know that when, and I think companies are motivated to do something because they know that if their employees are depressed or anxious, their levels of productivity go down. And they're more likely to leave the job. And that can be quite costly for employers. So I do think that employers have a special role here to play, that they can offer mental health, whether it's coaching, therapy, apps, all sorts of tools and products that they can offer to their employees that really kind of, to some extent, normalize the experience of having a mental health problem, and also help people to get the necessary services they need to feel better. So I think employers have this really crucial role.
Right. Amy, what do you think?
Yeah, so I would have said something about Lyra, but I was not working there for 5 years. But I think what they're doing in terms of marketing to employers, look, the traditional insurance and access and mental health is really challenging for anyone to work through. Even though a lot of workplaces provide those benefits, they're still really challenging to get an appointment that fits with your work schedule. And so the fact that employers are now understanding and seeing the benefit of mental health and buying into some of the services that exist, I think is really crucial. I know this is about adults and not young people, but I focus on young people, so I'm going to bring that in anyway, which is that I think that a lot of our change in youth mental health also relies on adult mental health, and a lot of adult mental health relies on workplace mental health. Because if you have a young person who's anxious or depressed and you give them the most high quality, culturally competent therapy that you can, and then you put them back into an environment where the parents are incredibly depressed, stressed, anxious, that young person is not going to be able to really thrive. And so, it's the oxygen mask theory on the plane, right? That you have to put your oxygen mask on before you give it to another. I think that part of investing in the mental health of young people is investing in the mental health of adults, and because a good part of their life is spent in the workplace. And I think that COVID provided a shift for people in terms of for some people prioritizing life. One, there's a lot more stressors, and two, it helped people sometimes think about what their priorities are. And for a lot of people, that didn't mean putting in 10 hours a day at a job where you felt like you were never good enough. And so I think that that is kind of, there's the overall mental health concerns, but I also think that people are focusing on their own goals and wellness, and that workplaces are probably also going to have to adjust in some ways to a workforce that wants to have wellness and work together, and that there are some situations in which those two do not collide as well, and that places that are going to be more successful are probably going to have to figure out how to do that. How do you take care of your employees, and then of course the trickle down to how that impacts youth mental health and wellness too.
I was just gonna ask about that, because what advice would you guys give? Let's say you get a call from a CEO or a HR director at a large company in the Bay Area, and basically they're saying, help me. I have no idea what I'm doing. I mean, people are quitting, people are not showing up, just how do we begin to wrap our minds around getting the oxygen mask on adults who are at work and then having to come home and deal, with family life, when going to work is such a big proportion of most people's lives these days? So do you want to start off with that, Amy, and then we'll go to Renee? It's like, what do you say when you get that call from a leader in a company saying help?
I mean, what I do is I probably refer to one of the companies that addresses and deals with it, because I will be clear, it is not my area of expertise. But I do think in terms of, directions that wellness has to be centered in part of the organization throughout it, that those options exist, and at a number of corporations, a number of businesses, and that as folks become aware of them, that those are places that people are more drawn to. I also think that if you look at the research on particularly things like turnover and productivity and what causes turnover, so I have done research in that area, like what are the factors that cause turnover and burnout? They're related to things like autonomy, decision-making, role clarity, to really think from an ordered perspective what you can do as an organizational assessment to, and so that's where I'm like, refer to the companies. There are companies that do wonderful organizational assessments to figure out like, what are the areas that are really causing this workplace stress? Because you may not, other than providing the therapy, you may not be able to fix what's happening in the home right now. You may not be able to fix, you certainly can't fix a global pandemic and the stress that are occurring outside of that places, but you may be able to find ways to make workplace a healthier place where folks want to come, where they want to bring their health. Most people actually want to find value in their work, right? It's not that people are like, I'm quiet quitting because I think that everything is, people who find value in their work are happy and productive workers. And so it's how do we bring that part back? And part of that might be an organizational assessment to figure out like, all right, where are you lacking? Because my guess is that burnout is the piece in the middle. And we have lots of ways that we can look out how we change burnout.
Wow, great answer. Renee, what do you think?
I love what Amy said. I would just add that in doing sort of an organizational analysis, I think it's important to also look at DEI and B. There are some great organizations out there that can do an analysis for companies and help them to understand. They can do surveys and then help them to understand whether they are providing equity for employees, whether they're being inclusive, and help them to identify ways in which they can be more inclusive. And I think that's another step that employers can take that will benefit the entire company.
Well said. I think we're at an interesting point right now, I think, in terms of, this historical moment in terms of the culture and work and coming out of the pandemic. Because prior to the pandemic, it's not clear to me that so much attention, even though the problem existed in terms of, access to mental health care and people struggling, but the focus and the interest on it has really opened up the discussion in ways that I haven't seen, at least in my career. And I don't know if that's the same for you guys. So that opportunity for this discussion is happening now, which is on the plus side. So where do we go from here? I mean, we haven't even touched the problem of like insurance, right? You know, people may need help, but there are all the impediments on the insurance side. I mean, we don't even have time for that. But let me just ask the broad question: where do we go from here? We're at a crisis. We know the basic outlines of the crisis. What are our next steps? Renee, I want to start with you, if that's okay.
Sure. I think we have to, this is a problem that I think we have to tackle from multiple angles. So I don't think there's just a sort of a methodical, linear path here. I think we have to hit this from, we need a broad spectrum antibiotic, right? We have to hit this from all different sides. So I think we've talked about employers, we've talked about potentially insurance reform. Value-based care is an interesting option. Tying payments to the quality of care that's received. Are people actually getting better? Or are they just staying in therapy forever? And that really isn't the goal for us therapists. We want people to graduate and go out and live healthy lives. And then thinking about technology and what role can technology companies play. So I think there's lots that we can do from all different angles. I think there's a lot from the government side as well. And maybe that's where, some of the insurance reform will come from too, but also policies that are, discriminatory need to go. And so I feel hopeful. I do. I know, Jess, you said in the beginning.
Oh, I'm hopeful now. I'm hopeful now after listening to you guys.
Okay.
No, I mean, I'm, having Doctors Green and Schneider has transitioned. I've transitioned from despair to hope again. So that's great, because I go back and forth all the time, right? As we all do. So after listening to you guys today, I'm really much more hopeful. So I hope I could stay in that space for a while. Amy, did you want to jump in a little bit? And then I want to make sure there's one question from an audience member that I want to make sure we get in. But
yeah.
Do you want to take on this question of like, okay, now what? Where do we go from here?
Yeah, and I think Renee, it's not going to be terribly different from Renee's answer, which is that I echo we need lots of options. There's not going to be one thing. I think also we need, tiered options, so that if you have an LGBT young person who needs service, but they're not out to their parents, but that they have options such as in their schools, that we think about where young people are, how we meet them there, whether that's, online connection groups or whatever we're going to rebrand group therapy as, or they are individual therapy. I also think something that we talked about earlier, the paraprofessional, and the idea that like there aren't going to be enough licensed clinicians anytime soon. And there don't need to be enough licensed clinicians anytime soon, because as Renee mentioned, there's research that there are other people other than those of us with licenses who can be just as effective of providing these services. And so thinking about ways that we can spread access to people who need it outside of the traditional, like, yes, there is still definitely a role for traditional licensed clinicians, but how can we give up some of that we hold as we're the only ones who should be doing this, and empower other folks to take on that role? It could be peers, it could be coaches, it could be really anyone who wants to support mental health to get that spread.
Schools. Yeah, I know. I love that, Amy. Like, I didn't mean to interrupt, but like, we haven't even talked about the potential that schools have for helping kids and adolescents.
Right. And there's the funding streams they can come when we think about policies down to schools to provide there's a lot of great, in addition to just schools, a lot of schools have school-based health centers, which are often like federally qualified health centers that work with the schools to provide full spectrum healthcare. So not just mental health, but full healthcare. And one of the challenges is, again, the shortage, right? There's a shortage of mental health providers. Well, that's where tech-enabled solutions can come in, whether it's providing teletherapy to young people in the school setting. There's a group called Hazel Health that has really worked in that area in terms of how do we provide access to young people in schools because they're there, but but where are young people and how can we get it to them? Because like, I think the theme that we're coming up here is that this is just an access and a shortage of people to provide that access. So that's the issue that I think we're solving right now. And I think there's some, I don't want to call them solutions. There are some pathways that will work.
Pathways.
Solutions.
Yeah, pathways. We got about 5 minutes left, guys, and we're getting a lot of questions in, but there's one question in particular I want to throw out to the two of you, which is, what advice would you give to a graduate student in mental health right now in terms of thinking about their career and going forward? And I don't know where this graduate student is in terms of where they are with despair and hope in that space, but if this person came to you and said, oh my God, what advice do you have as I'm kind of in the middle of my career at graduate school right now, what would you say? Amy, you wanna start, and then we'll go to Renee?
Sure. So one, thank you. And congrats on making it this way in grad school for mental health through a pandemic. It's more than I had to do. But the challenge is figuring out how to focus your energy. One of the things that I think is really impactful is to diversify yourself, meaning mentor others as you gain the skills. Use that, like, spread your knowledge, get the expertise that you need. When I did training in children, adults, families. So I have that sort of diversification, which allows then to see different situations from different perspectives. So get that breadth of experience while you're in graduate school to help you figure out, so that you have more options of where you want to go, where the need might be. And then to the extent that you're able to mentor others along your path, if your call is, how can I help change this mental health crisis, as we're talking about this being an access and a spread thing, that would be one of my areas as well too, is like get others on board, start a coalition, and then also to take care of yourself, because we talked about burnout in the workplace. Burnout among mental health providers is also quite high. So my other call would be to take note of yourself, have those connections, a peer group, who you're close with, who you're in this work with, and make sure that you're able to do it for the long haul.
Great. Renee, we only have a couple of minutes left. Do you want to take a minute and
yeah, I'll be quick. I would just say two things. One, my heart goes out to you, because graduate school is tough. It's tough for everyone. And then the other thing is, this might sound trite, but connect with what you're passionate about. Really find what you care about and dig in. And don't let people dissuade you. You might have an idea that is completely different from what your advisor thinks or what other people think, and that's okay. You follow. I would just encourage you to follow what drives you and what really your passions lie.
I want to echo both those answers and just say, for prospective graduate students, congratulations. And I can say from my own experience that even though it's the most difficult thing I've ever done in my life, it's also the most rewarding. So you have to be able to understand the contradiction of how difficult this work is, at the same time with how amazing, rewarding, and awesome it can be. And as an example of that, I think we need to look to our two panelists, Doctors Green and Schneider, who are just like wonderful scientists, clinicians, amazing practitioners, and people who just have done a great job kind of articulating and speaking to this very complex crisis that we're in the midst of right now. And I want to offer my heartfelt thanks and gratitude to both of you for spending some time with us today. And also want to thank the Bay Area Global Health Alliance again for sponsoring this event. And listen, I'm sure that we didn't get to all the questions. I'm so sorry about that. Those of you who are watching know you can get a hold of us and contact us afterwards. I'm sure, I shouldn't say sure, I know that we would be, very eager to kind of, get back and respond to some of your questions that we weren't able to get to today. But as I said, I'm just really grateful to Dr. Schneider and Green for their time today. Thank you so much to both of you. And thank you to the audience for spending an hour with us today. We really appreciate it.